Alzheimer. Penyakit Alzheimer ini diambil sempena nama seorang pakar sakit jiwa dan pakar patologi iaitu Alois Alzheimer pada tahun 1906. Penyakit Alzheimer ini sebenarnya adalah sejenis penyakit penuaan pada sel otak yang berlaku secara perlahan dan berterusan. Penyakit ini menyumbang hampir 60 hingga 70% kepada keadaan nyanyuk.
Alzheimer's is a type of dementia. So the dementia is a umbrella. Under that umbrella of dementia, Alzheimer's is the most common form of dementia. It's about 60%. The rest, maybe 25% vascular dementia and other different types of dementias. So often people will think Alzheimer's, is it dementia or not? Or dementia, is it Alzheimer's or not? It's the same, but Alzheimer's is a type of dementia that is most commonly seen.
Hingga kini, punca sebenar penyakit ini tidak diketahui. Bagaimanapun, saintis berpendapat ia dikaitkan dengan pembentukan dan perubahan pada sel-sel saraf yang normal menjadi serat.
The symptoms of dementia, any form of dementia, is often forgetfulness. It's a short-term memory problem. They can remember the past very well, their childhood days, their school days, they can remember very well. But what had happened yesterday, a moment ago, an hours ago, they will forget. So that is the main problem. So because of this memory loss, slowly they also will lose their ability to live by themselves. So it affects their activities of daily living. At the initial stage, what we call as instrumental activities of daily living, where the person's higher functioning is affected. The driving skill will be affected, they will find difficult to drive, or they get lost their way, they don't know the way to come back home.
Even like he has lunch, immediately after the lunch he will be asking me, have I taken my lunch? You know, something like that. Yeah, same with breakfast and whatnot. And forgets to bathe, that one you have to remind him that you need to go and bathe and things like that. Changing clothes and all, you have to put the clothes there for him to change, you know.
As the disease progresses, slowly their basic activities of daily living will be affected. For example, like bathing, they go inside, don't know what to do, they come out without having shower. Will have a lot of trouble with remembering, so it is difficult for them.
Hallucination, sometimes they will tell you, got people there telling me to do this and things like that.
So as the disease progresses over the years towards the terminal stage, you need to really take care of them of a real baby. Yeah, that stage will come. It is not so fast, it will take years, it will take years, so you need to be prepared for it.
I will be looking for my handphone, I can't find it. Then he will be carrying his handphone in one pocket, mine on the other pocket. And when you ask him, he said, no, I don't know. But then you check the pocket, you will have it.
Often they misplace their things at home. They put in one place, they search another place, then they complain somebody has stolen their belonging. So that can cause family commotion, family conflicts. So often they talk the same thing over and over again. Family members get very bored, irritated. So we need to understand that they have forgotten. We need to help them. If you don't care about them, if you don't listen to their talk, they will feel very belittled. So we need to talk to them. They can tell 10 times the same story, nothing wrong in listening, as if you are listening for the first time.
We really have to be patient, or else we'll jump into her, because very frequent almost that she's forgetful, and then she will always throw her tantrum. The tendency of throwing a tantrum is very frequent.
Along the way, when the person is declining from mild stage to moderate stage to severe stage, along the way they will develop some behavioral issues where they will start screaming, yelling, shouting, shadowing. Shadowing means when the caregiver goes anywhere, the patient will follow. Just like a little kid following the mother wherever mom goes. So these are the things that can happen that can be a lot stressful for the caregivers.
When the son kept telling him, I'm your son and all, you are my son. He was asking him back,
I was asking whom?
Asking Rajesh.
Rajesh. And he's my own son. And I asked him like that. I feel ashamed,
When you suspect any one of our family members having memory problem, always you can come to memory clinic. We take a good history. After that, we will focus our investigation. Depending on the patient's problem, we will do some blood investigation, x-rays or scans. Then we will come to a diagnosis. Once we confirm the diagnosis, then we will start with medication. So for mild dementias, we always try to start with cholinesterase inhibitors like Aricept or Exelon.
Exelon patch, it's just the patch only. He's wearing it in the hand. You have to put it on the muscle, not on the bony area, on the muscle. Once you put, you cannot use the same area again for about 120 days. So, but it will leave a rash there. So you have to find new places to put it every day. So all over the body, the stomach, the chest, the legs, front, back, here, all that you can put.
As the disease progresses, the pathology will be in a different place. So at that level, we will use what is called NMDA blocking agent, that is N-methyl D-aspartate blocking agent. Otherwise, it is called memantine.
Before, he is not able to read, he doesn't want to read books, But now, after I started on memantine about 6 weeks or so, I see him going to the bookshelf, taking a book, sitting and reading one day. I was actually surprised.
These medications are not a cure. This is only to slow down the progression of the disease so that they can have a better quality of life, they can take care of themselves for a longer period. It is important when people with dementia, they should come here to the places like day centers like this because it is important. It will delay the progression. We have specific activities. For mild dementia, we have specific activity. For moderate dementia, we have specific activities. So this, even for severe dementias also, we have some activities for them. So it covers the whole range of mild, moderate, severe dementia. So when they do come here at the early stage, they can get used to the place here. They get socially connected with other people. They keep their mind active throughout the day. We don't allow them to sleep. From the morning they come until the time they go, they are doing some activities. So usually in the morning we start with morning exercise in the sunlight to get some vitamin D. Later they'll come in and do indoor activities, some games. Then they will have singing song session together where we mix the mild, moderate, severe together at one go. And then we will separate them into different activities. This room is for people with severe dementia where they are not able to do a highly challenging activities. So they are given activities according to what they can do. So this is beading. Beading is one of the interesting activity they do. It's not just the bingo and the beading. We have many other activities. We will do it at regular intervals. This activity room is for mild dementia, where people with mild dementia can do cognitively more challenging activities. Bingo games is one of the games they really love to do that.
If I don't send him to the center, I keep him in the house. He's alone in the house, just the two of us. No activities, Whereas here, he's mingling around with so many people. And the physical activity, exercises, and then the mental stimulation, it all does a lot of good for him.
Since we don't allow them to sleep here, throughout the day occupied, when they go back home, they can sleep well. We no need to give sleeping tablet. Every year during December, that is the World Alzheimer's Month, we do have a memory walk where we have walks in the city to tell people forgetfulness in old age is not a normal part of aging. You need to come and get early treatment. So we treat early, they can have a better quality of life for a longer period of time. Without medication, they will go down very fast.